You seem like a very active person. Tell me about your life before you had spine problem, and then during you had spine problem up to surgery. Tell me a little about what you were going through.
So before, I couldn't walk farther than 3 blocks.
Before the surgery?
Before the surgery.
What were you doing before all of this started though? You seemed like a very sporty, active person.
Golf, exercise, do yoga, go kayaking.
Mm-hmm. And then you stopped doing all of that?
Yes.
So how was it? What time frame? How long did it take you before the surgery?
2 years.
2 years.
Before I came in.
Yeah. How was daily activity and walking? What could you and what could you not do?
It was limited. I was in pain every day.
1 to 10, how bad was the pain?
I would say 8 or 9.
8 or 9 in the back or leg or both?
The back mainly, and then my leg was always numb.
Yeah. Can you show me where your symptoms in the legs were?
From here all the way down into my foot.
The foot. So L4 and L5, and as well. What about side of the thigh? Did you have symptoms there? Symptoms there. So you had L4-S1, what we call degenerative disc disease, spondylolisthesis, and stenosis. And about a year, it's not quite a year, it's about, I think, 10 months? About 10 months ago, we did a 2-level fusion OLLIF procedure. And it seems that the bone is beautifully growing. These are the screws. Bone in the back is growing. And as well, here, very solid growth of the bone. And all the screws are good. You don't have spondylolisthesis and stenosis anymore. And bone is as well growing both in the back, here, but as well in the front. Now, this is by any standard, about 5 hours surgery, but your surgery wasn't 5 hours. We did an OLLIF procedure. It took us literally an hour to do the surgery, and we barely lost 2 ounces of blood. How long did you stay in the hospital?
A day.
A day. And when did the leg pain go away?
As soon as I woke up, I
noticed.
noticed.
So you woke up and the leg pain was gone. What about the back pain? When did it become tolerable?
When I woke up.
Yeah, that's so okay. Now
it was like a dream come true.
Now, how long did it take for you to get back to your basic daily activities after the surgery?
I went home and took care of myself, so I was okay.
When did you go back to work?
A few months after.
Yeah. Now, what kind of work do you do?
Customer service in a store.
Okay. Now, overall, are you your daily activity, walking, exercising, and so on? Is it where you need it to be?
Yes.
Excellent. Now, have you had a chance to look into alternative to what we did, to open surgery before the surgery? Did you have a chance to compare our surgery to open old-fashioned surgery? What did you find out?
The recovery time's a lot longer, and it was not as many guarantees.
Yeah.
A lot more invasive.
Yeah. Now, obviously, for area we did the surgery, we are done. But about 40% of the patient that they have any kind of spine problem, they have as well what we call sacroiliac disease, and you do have some sacroiliac disease. Is it bothering you much at this point?
A little.
A little.
Not terrible.
Well, that would be something to look for, because we know 40% of the people who have spine problem develop sacroiliac problem. And as well, when it happens, it's a little to the side, and as well sometimes they're growing, especially twisting. So these are the usual things to look for, okay? So in that sense, I hope I never see you again, because that means you don't have that problem. But if you have that, you know what's going on.
Right.
Okay. One last question. When I'm looking at that, I see almost a hole here. Has anybody talked to you about that right here?
No.
So this is what we call the aneurysmatic bone cyst. Meaning sometimes, some people have a cavity inside of their bone, and that cavity can be filled with blood, as all bones are. So about less than 5 to 10% of the people, that cause some pain, local pain there. So that is something you just need to know. It's what we call incidental finding, meaning that we just see it because it's there. Most likely won't be causing you any problem. but that is what it is. If anybody mention you to that, that
or
hole
is
here
it
in the
called
bone.
a lesion?
A lesion is everything is a lesion in medicine.
Okay. 'Cause,
Okay,
yeah, I think
anything
they
that shouldn't be
yeah.
there, we call
Yeah.
it a lesion.
Okay.
But the more accurate name for that is an aneurysmatic bone cyst.
Okay.
Okay. Now you know everything. Any other comment or question? Overall, happy with the results?
Very happy.
Well,
Very
thank you so much.